My name is Ivy. I'm the diabetes specialist at Phoenix Diabetes and Endocrinology. I'm going to give instruction and demonstrate how to give a vitamin B12 injection. On our website at phoenixdiabetes.net, there is a download for written instructions that accompany this demonstration. You will need a syringe, which will be prescribed by your physician depending on your size and where you're going to inject. You will need the vial of B12, which can come in a 1-dose vial or a larger 10-dose vial. And you will also need an alcohol swab, or you can use a cotton ball with alcohol. Either is okay. The next step is to wash your hands prior to any preparation or injection of the medication. Step 1 is to draw up the medication. If you're inexperienced, this may be a little tricky, but with practice you'll get it down. Syringes open with a split packaging, so you find the split ends and just pull them apart and hold the syringe. Now once you've started this step, you want to keep everything clean. Needles may be a little loose in the packaging, so you just want to tighten the needle by twisting it clockwise and making sure the needle is on firmly. Something I remember from nursing school is needles twist on, therefore your tightening of the syringe, and caps pull off. So that is something that may help you remember so you don't twist off the needle when you're pulling off the cap. So we're just going to loosen the cap at this point, but keep the needle covered. If you're good at removing the top of your vial without touching the rubber stopper, you don't need to clean it, but to be on the safe side, what you can do is just give it a mechanical clean on the alcohol swab or the cotton ball you're using. With 1-dose vials, a little air needs to be injected into the vials so the medication will flow easily into the syringe. If it's a 10-dose vial, you will need your whole dose of air because the bottles are pressurized. Let's get familiar with the syringe a little bit. When you're going to draw up your dose, the doctor will tell you how much you're going to be taking. In vitamin B12, it's usually 1,000 micrograms, and in medical talk this will translate to 1 cc. As you can see on the syringe, the markings are pretty clear, and what you want to do is pull the plunger back to the line that's closest to the needle with your dose. And as you can see, I've drawn up 1 cc of air. For the one-stop vial, I'm not going to put as much air as because it creates too much pressure. So I'm just going to put about 1/4 of a cc just to get the flow into the bottle. So your bottle is cleaned. When you're holding a syringe, basically I just like to use the dart method. I have it between my thumb and my second finger, and then I have my first finger ready to press down on the plunger as I need to. The air is injected into the bottle, and the simple way to do this is just hold the bottle on a surface, put the needle in, and push the air in. The harder part comes when you put this upside down to draw out the medication. And in the small 1-dose vials, you need to be very careful to withdraw the needle till you can see it at the bottom of the vial. This assures that you are under the medication. You're going to pull back the syringe, and the liquid should flow into the bottle without much resistance. So what I'm doing is filling up the syringe. While you're doing that, you can push the air back to the vial and see that you have the proper amount. So it takes very little to get to the 1. It's also okay to overfill a little bit and then push back what you need. There are 3 injection sites that can be used for the B12 injection. The thigh is one site, and that can be used by you if you're doing the shot to yourself, probably most easily. The other part is the upper arm, and some people can actually inject in their arm themselves, and if you're having someone help you, that's a great place to give an injection. And the third place is in the buttock, and we will demonstrate how to find the proper location to give the injection in all 3 sites. First, let's talk about the thigh, because that is the easiest for someone giving a self-injection. Okay, to find the proper injection site, it's very easy to locate. You put one hand over the knee and one hand around the hip, and you have this middle area to give the injection. In this area is a large muscle, and it can be given anywhere in this area, and what you want to do is just aim off from the side a little bit and go off center. Can you flex your muscle for me? And if you're not sure where the site is, if someone flexes their muscle, you can feel it very nicely and identify your sites when the person flexes it, so you can see exactly where you need to inject. In an arm injection, it's almost the same thing. You put 2 fingers on the bone, which is the shoulder, that you can feel the articulation there, and probably a hand around the elbow, and again you have this area where there's a muscle. You flex your arm. Again, you can see it when someone flexes, and I would pick the spot right here. As I can tell, it's a great site. When you give injections, you're going to have people relax, though. The most painless body part to give an injection in is the buttock, and it's very easy to use. All you need to do is divide 1/2 of the buttock into four, like a checkerboard, and you're going to use that upper outer quadrant. And you can give your injection anywhere in that site, and you want to stay away from the middle of the buttock because there's a nerve running through it. So this is an excellent site to give an injection. Picked our injection site. The next thing we're going to do is clean it with the alcohol prep. And when you clean from the center moving out. And you want to not touch the site where you're going to give the injection. Holding the syringe like a dart, if you want, you can stabilize the skin between your fingers. Your first finger is going to be on the top. I like to put the needle in not fast, not slow, but evenly, exactly like a dart. And you're actually going to dart the needle all the way in because this medication has to go into the muscle. So you dart it in, and when you've got it in, it will be stable. You can take the other hand, hold it while you pull back to make sure any blood does not enter the syringe. If you see that blood does not enter the syringe, you go back and you inject the medication slowly, evenly. This is displacing skin, so I try not to do it too quickly because they may feel it more. And when you're done, you want to withdraw the needle quickly. If there's any bleeding, you can hold a cotton ball over the site for a few minutes. And then if there's still some bleeding, you can apply a Band-Aid. We're going to demonstrate the injection technique in one step so you can see how the flow is. Again, a hand by the knee, a hand by the hip, so we have this area. We'll make a muscle, and we can see that this person, we're right over the muscle. We don't want to go midline, we want to go off to the side. The person can relax. Oh, we give it a clean, again, going from the inside out. We can firm up the skin a little bit. 1, 2, 3. We check for any blood return. There's none. And then we just give it slowly, easily into the muscle. And when you're done, just pull it out and hold some pressure so it doesn't bleed. The last step is disposing of the needle. It's best not to recap it. If you can, just stick it into a medical waste container